Thank you, Mr. Deputy Speaker, Leader of the Opposition, Ministers, Members of the Parliament. I rise today to speak, to support and to endorse the budget that has been presented in Parliament. But at the outset, I'd like to address initially some of the comments that have been made during the course of this debate. One of the comments that has often been made from the members of the other party, that the government on this side lacks vision, that perhaps the budget does not have a theme. I'd like to say that this is a false understanding of what government is all about. Our vision on this side of the House is very clear. And what we've just heard from the Honourable Tigala is an exposition of exactly what we are against. We believe we have a vision that we have a strong, united country where everybody in this country is regarded as one. When we are able to do that, we will have a strong country. We have heard today some of the most despicable filth that has ever come into this House. How can we have that in the most august House? The only thing that I'm glad, Mr. Deputy Speaker, was that the children that were sitting here are no longer here to hear those kinds of sentiments. The strength of this country depends on all of us being able to work together, to see ourselves as one country. When we start trying to find conspiracies under every sheet of paper, under every mat that you have, you interpret things that will lead to the destruction of this country. Fiji First Government, this is what we stand here for. A united Fiji. A united Fiji that builds a strong country. A Fiji that does not demarcate people according to what their hair looks like, or whether they have their hair or don't have their hair, what their religion is, what they speak, what they eat. We treat everybody equally. And when we are looking at our country, and when we are trying to tell ourselves what should we do in this country, we don't look at the ethnicity or religion of a person. We choose the best possible person for every occupation. So because it is all based on merit, because if we are able to do that, they can do the kinds of things in those organizations to deliver value for our people. And when all of these organizations, whether you're talking about ATS or FBC or Fiji Pine and all of these companies, when they begin to develop a lot of profit, then we are able then to provide services to all of them. So I think we should all learn, Mr. Deputy Speaker, to look at everybody equally in this country. This is the same sort of rhetoric that took this country to the ravine that the experts talk about. This is the same sort of rhetoric that took it. And this is something that we must put a stop to in this country. And it behooves all of us in this House, every single member of Parliament, to make sure that these kinds of sentiments are not expressed in this House, especially when the people of this country. That is the vision of this side of the House. Vision of this side of the House is for the benefit of everybody in this country. This divide and rule tactics of saying we should do these things for this group of people and something else for a group of people, that's out of date. That was 20, 30 years ago. That's what led to the decline in this country. That's why we needed a new revolution under the Bainimarama government and the Fiji First government to come up with this constitution and put things right for the benefit of everybody in this country. Thank you. The other reason that I'm supporting this budget for, Mr. Deputy Speaker, is because if you want to build a country, you need to generate economic growth. If you look at the history that we've had in this year, 2016, this will be the seventh year that we have had consecutive growth. Sometimes the members of the opposition don't realize how great that is. That is a fantastic thing, 7 years of consecutive growth. And it is building on all the things that we've done in the past. It started from the things that were done by the Bainimarama government, and now in the Fiji First government, we're still moving, we're developing growth. More jobs are coming through, even in spite of the fact that we've had Tropical Cyclone Winston. Didn't you hear the statistics that were given by the Minister for Employment? In spite of all that, things continue to grow. A few days ago, the Minister of Trade announced that a lot of the investment that is taking place in Fiji is coming from the private sector. Calm down, take it easy. The truth hurts, Mr. Deputy Speaker, the truth hurts. A few days ago, the Minister for Trade announced that most of the investment in this country is coming from the private sector. What does that mean? The private sector does not invest willy-nilly. Listen. The private sector does not invest willy-nilly. They look very carefully. When they have confidence, then they invest. That's the other reason that I support this. The third reason that I will get there. Hold on. I will get there. The third reason that I support this budget because it has been consistent. Consistent in what terms? Consistent in its focus on all the people of this country. Consistent in its effort on the least marginalized. That is why we have allocations for free education, for free bus fare, free medicine. We are always concentrating on those right at the very bottom of our society. There has always been consistency in that plan. I'm coming there. And now I'm there. There have been some false information. We've been sitting here and we have been inundated with these false figures and false statistics. There seems to be, I don't know whether it's intentional or whether you're being intentionally blind or intentionally deaf. Some of the things that have been coming across from the other side. The health budget, this government pays a lot of attention to health, and we regard the health of all of our people as one of our most important and sacred responsibilities. Some speeches have been made that the health budget has gone down. The health budget has not gone down. Within the budget for this year, we now have 244 million within the health budget of the Ministry of Health. But in addition to that, we have another $41 million just for the doctors, which will be governed by the Ministry of Civil Service. If you add those figures up together, it adds to more than 285 million. You add the amount that is added for the training of doctors, which is 1.16 million, and another 2 million, which is in the rural development for the development of facilities and quarters, it becomes to more than $280 million. That is a true reflection of the importance that this side of the House attaches to health. And the other thing that this budget has shown, which is for me as a Minister of Health, is something that I really appreciate, is its emphasis on human resources. This year, they will be focused on our doctors. This year, we'll be looking at least increasing their salaries by between 56 to 81%, because they are a very important component. We've always had a problem in the past, being able to develop and retain our doctors, and with this, as part of the reform within the civil service, within government, we'll be able to develop them. We'll be able to retain them, and we'll be able to develop a cohort that will allow us to address the kinds of things that we need in this country. This is part of the overall reform that we have for the civil service. We need to have the right fit of people, the right shape and the structure, so that we can begin to develop the services that we have. And in addition, there's money being set aside for the training of doctors, 1.16 billion, another $500,000 for the training of other cadres, and another 180,000 specifically for the nurses in the Fiji College of Nursing. The Honorable Biman Prasad had talked about specialist positions. Yes, specialist doctors are very important. Over the past few years, the Ministry has realized this. And working together with the FNU, who have been able to put together a program to develop specialists, we now have around 63 doctors undergoing their training program to become specialists. Around 11 have already graduated with their master's program, and another 11 have undertaken their postgraduate attachment after they have completed their master's training program. So there is a pipeline. We still have deficiencies in terms of the numbers that we have, but through this pipeline and also through the kind of activities that we get through the Skilled Professional Act, we are also beginning to see skilled professional workers enter into the private sector, of the private part of the health sector. So there are developments in terms of making sure that we have the right kind of people within place to deliver services to our people. There has also been talk about the free medicine initiative. Yes, I will agree that there have been some hiccups along the way, but we are getting there. This year, in another 2 months' time, we will have the full complement of all the 142 medicines that will be part of this free medicine scheme, and the processes that need to get everybody on board to be registered are being fine-tuned, so that by the end of this year, we hope to see the free medicine scheme working well for everybody. But still, if people walked into a health center or a hospital, they get free medicine anyway. But this is just for those that are outside of the, that do not come to the normal into our public facilities. There's been, Mr. Deputy Speaker, sir, there's been a lot of investment in this budget, for which I'm grateful for a lot of the capital projects. Health, you require good people, you require medicine, you require equipment, and you require places for them to work, good buildings. This year we will see the completion of the new Mba hospital, where 13.35 million has been set aside. That hospital is an example of a partnership between government and the private sector, and it's going to be a model that we can use in other areas. There will be the upgrading of the Kayasi from the health center. It is now to a subdivisional hospital of around 6.3 million. The upgrading and extension of the Rotuma hospital for 2 million. The completion of the new Naulu Health Center, which I'm glad to report that the civil works has just been completed. The construction is about to commence now, and hopefully by the end of the year we should have this health center online to relieve the pressure on Nosori and Valley Level, and also on the Suva. There's one of the most important things that we have is to make sure that our health centers, such as the one in Ngaloa and the nursing station in all of these areas, and Korobisolo also, that is maintained, and government has set aside $2 million to make sure that these facilities are up to speed and they can continue to provide service. There's been some questions asked in the House about the extension of the CWM maternity unit, and I can inform the House that this project is continuing. It is not an easy project to do, because where the extension takes place, there's a huge ravine. If you go to CWM, you see the huge ravine, the huge gully. So there needs to be a lot of expertise hired to make sure that they can undertake the geotechnical work that needs to be undertaken. There's payment of consultancies, and over the concept design and the project manager has been put in place. So this will be an ongoing. We do not expect construction to take place right away, but it should take place beyond 2017. There's also been some questions in the House raised about the McCoy birthing unit. I am glad to say that despite the fact that we had multiple landslides that led to the delay in this project, where we had to build a retaining wall at the back of the unit, that project is expected to be completed by the end of the year. And when it is complete, we hope that it can relieve some of the pressure on Nosori and also on Suva in terms of our mothers who are in Rawatu. In addition to all of this, Mr. Deputy Speaker, there's going to be an investment also in the Eastside ICT infrastructure and network. One of the most important things that we need to do is to manage data and convert data into information so we can make use of it. There will be an investment of around 350,000 in this, and also during the course of Tropical Cyclone Winston, a lot of our facilities, about 25% of all of our facilities, underwent some damage or some were completely destroyed. The government has set aside 3.656 million to be able to deal with these facilities all across Fiji, all the 200 plus facilities. There have been some questions raised in the House about Nosori and in the Nasinu area. Nosori plan is being reviewed at the moment. For the Nasinu area, we already have Valley Level in place. Over the next few years, we hope to be able to acquire land to make Valley Level bigger so that it can deal with the population that it has in that particular area, and also relieve some of the pressure that CWM currently faces. Mr. Deputy Speaker, in health, there are different services provided for curative, for curing people who are already sick, for rehabilitating people, and trying to prevent, and also in preventive health, to try to prevent people from becoming sick in the first place. Strategically, in the ministry over the next few years, we will begin to pour a lot more attention on this preventive focus, a focus on public health, on keeping those who are well, and trying to reduce people becoming sick in the first place. Public health saves money, it improves our quality of life, it helps our children thrive, and reduces human suffering. And this has been reflected in the strategic plan of the ministry, in which we intend to provide more resources over the next few years towards prevention activities, especially those in the different settings. This year, in this budget, there is a sum of $6 million which has been set aside for public health that is managed from within the headquarters. And that is going to move us towards this direction of prevention activities. In addition to the money that has been set aside for public health, there is also funds of money that has been allocated to our divisions. We have 4 divisions in the Ministry of Health: North, South, Central, and Eastern. In each of these divisions, they do a lot of work in terms of meeting people out in the divisions. And for the division level, there is a combined budget of more than 44 million, a significant portion of which will be used for public health. In the Ministry of Health, we have welcomed the increases in the price for cigarettes, alcohol, and sugar-sweetened beverages. We all know that the biggest killer in our country are NCDs, non-communicable diseases. And wrong food, smoking and also wrong drinks are some of the biggest risk factors that we have. The cost of people eating the wrong food, smoking, and indulging in too much alcohol is felt in our hospitals. That's where the cost comes. So through this way, we hope that we'll be able to encourage people to indulge less in these risk factors and also help pay for the costs of running the hospital services. Immunization is also a major strategy for preventive health, and that is also being funded. The major approach that we'll be introducing this year that we need to go stronger in is a more multi-sectoral approach to NCDs, because it is not something that can be addressed by health alone. This will require cooperation with other areas like trade, agriculture, employment, local government, housing, and a national NCD multi-sectoral committee will be put in place following this budget. Most of the budget currently, in this current budget and in past budgets that we have had, Mr. Deputy Speaker, have been used for the curative services of our ministry. In other words, for dealing those who are already sick. Our combined budget for our specialist hospitals in this period from 2016 to 2017 is 69.9 million. A significant portion of the budget for the 4 divisions will also be used in the subdivisional hospitals that will help our curative services. In addition to this, we have 37.7 million that has been allocated for the procurement of major consumables such as drugs, X-ray materials, dental prosthetic, dressings, beddings and linen, family planning supplies, staff clothing, laboratories and so forth. For overseas visiting medical teams, we have $500,000 to help them come and provide their services in Fiji. 1.3 million is provided for expenses of overseas and medical consultation to cater for the increasing number of patients requiring overseas referral for special treatment that is not available in Fiji, such as cancer and cardiac referrals. We often have cases, Mr. Speaker, Deputy Speaker, of people needing to be brought to Suba or to Lotoka or to Lombasa from outlying areas, and 2.2 million is provided for the charter of aircrafts to meet the high demand for medical evacuation of high-risk patients from the locations mainly in the rural and maritime areas. Biomedical equipment for hospital health centers and nursing stations, we have $5 million set aside for that. Dental equipment for urban hospitals, subdivision hospitals is $500,000. The upgrading and maintenance of urban hospitals, institutional quarters is $2.5 million, and the purchase of equipment for urban hospitals, health centers and nursing stations is $1.8 million. These are some of the major expenses that we have, and we are very grateful to get this budget. In every ministry, we always want as much resources as possible, but we believe in the Ministry of Health that the resources that have been given to us will be there that will allow us to move our services towards the vision that we have, which is to develop as healthy a population as possible. One of the important developments also that you will have heard from the Minister of Economy is an announcement that there will be a hotline established. Hotline established so that people that have issues with health services can phone in and make their complaints known. This is something that we welcome, because we believe that complaints is always a gift for us. It helps us to understand some things that are not going on as well as they should, and they will complement the assisting that we already have within the Ministry of Health, using our risk managers and our clinical service networks to keep improving the service that we have. One of the statements that has been made in this House over the past few days has been that health in general has been declining. When these statements are made, they are not quoting any sorts of data. So I think this is one of the important things to do. As leaders of this House, if you're going to make a statement about anything, if you say most of people are dying or anything like that, you need to substantiate it with data. We cannot just stand up and make statements like that. They need to be substantiated with data. I had a look at the information that we have in terms of under 5 mortality. Under 5 mortality, and there's been a lot of concern with under 5 mortality. I've looked at the data, and it is shown that under 5 mortality has been reduced from 21.8 in the year 2000 to 17.5 in 2013, and it still continues to decline. So there has been a gradual decline. So what I'm trying to say is, in some areas, some aspects of health, there can be anomalies every now and then, but generally there's been a decline in the mortalities. Generally, does that mean that we are perfect? No, it does not mean that we're perfect. It means that there's always constant room for improvement, and that is what the ministry is focusing on. At the moment, we realize that one of the problems that we have in the ministry, that staff need to communicate better with the people that they serve. And there is a project that is going on in the ministry now, going on right now, to improve communication, to improve cleanliness of our facilities and to reduce the waiting times that people have within the hospitals and our facilities. The other important thing that we're doing to try to make sure that our response is much better to our customers is to bring the values of the ministry to be part of our performance management system, so that people are actually measured against the values that we have within the ministry. And the last thing that I'd like to mention, Mr. Speaker, Deputy Speaker, is that one of the things we believe that, that is being mentioned right across the ministry is the need to strengthen leadership and management right across all of our facilities. And with that, Mr. Deputy Speaker, I strongly support this budget because it is according to the vision of what is best for the people of this country.
Thank you.